They are another tool in our toolbox as we work hard to save lives.
That tool, monoclonal antibody therapy. Governor Whitmer announcing the expansion of antibody treatments from Regeneron and Eli Lilly to help in the fight against the coronavirus.
Therapeutics are another tool, but they are not a substitute for vaccination.
So far, 6,600 Michiganders have received both treatments since they were approved for emergency use by the FDA in November. MSU's Dr. Subashi Mitra says expanding antibody treatments is a good call.
Monoclonal antibodies does reduce hospitalizations. That has been shown in the studies. Expanded access, should really help move the needle a little bit.
The antibodies emulate the body's natural ability to fight invading organisms. In the case of COVID, they bind to the spike protein of the coronavirus, preventing it from binding to a human cell, thus reducing the severity of an infection. But since the treatments have to be administered intravenously, access is a challenge.
Implementation is going to be a little bit difficult because, infusion centers mostly deal with vulnerable populations of, say, cancer, chemotherapy, or people dealing with very serious infections.
Regeneron and Eli Lilly are for COVID patients with pre-existing conditions or underlying health risk and must be taken early on.
You have a very short window to actually administer this. So these have to be given early on in the process when the virus has not attacked all the relevant cells in the body.
It's important to remember antibody treatments help prevent hospitalizations, but that's all they do.
This in no way does anything to stop the spread of the virus.
I'm Jamie Sherrod, WNEM TV5.